name is Marie Ruddy. I'm a vascular surgeon at the Medical University of South Carolina, and I'm very happy to be here with Humraaz Samra to share his work with the ARREST trial. Why don't you go ahead and tell us about your endeavors?
Thank you very much. I'm Humraaz Samra. I'm an integrated vascular surgery resident at Indiana University, and I'm very happy to discuss our work, the ARREST trial. It's a long acronym for looking at using mesenchymal stromal cells to reduce AAA or abdominal aortic aneurysm expansion.
And can you tell us a little bit of the background that led you to utilizing the stromal cells?
Absolutely, I'd be happy to. We did some initial work with mice in our lab, and we found that human mesenchymal stromal cells, or MSCs, in mice were actually able to reduce these AAA or abdominal aneurysm expansion. And using this idea, we thought we could apply it to a human model or human clinical trial. So we were able to obtain some funding and create a protocol that we were able to utilize and use these mesenchymal stromal cells and their anti-inflammatory properties to hopefully reduce AAAs in patients.
And I understand that you were targeting patients with small aneurysm in this group, is that right?
That is correct. With AAAs, surgical intervention is the only option once a certain size threshold is reached at 5.5 centimeters in men and 5 centimeters in women. And unfortunately, there are no medical therapies that are available for preventing expansion of these aneurysms. And we decided to use smaller AAAs because we believe there is a more inflammatory process as compared to a hemodynamic process, things like flow rates, volume expansion, that kind of thing at the early stages. And we figured, or attempting to figure, that stopping the inflammatory process using these mesenchymal stromal cells will actually prevent the expansion of AAA.
And what did you find? Can you share some of your results with us?
We had very promising results. We found that there was decrease in the aneurysm size. It is a smaller group, so much more work needs to be done, but we found very promising results with regards to anti-inflammatory properties or cytokines, things like interleukin-10 and certain types of inflammatory cells and anti-inflammatory cells, and the ratio that they had that was changing. In essence, the aneurysms were getting smaller, or sorry, not getting smaller, but they weren't getting bigger, and that the anti-inflammatory properties that we noted and we were looking for were seen.
That's fantastic. And patients did well? No side effects?
No side effects. None of the patients in our experimental groups needed to have any surgery afterwards after 7 years of follow-up, so everybody's been doing great and we're continuing to follow them.
That's fantastic. Any future endeavors that you're aware of so far?
Oh, I could talk about this for hours, but yes, we're hopefully modifying these mesenchymal stromal cells to further express these anti-inflammatory cytokines, IL-10, like I mentioned. We're also hoping to induce pluripotent stem cells from umbilical veins or other sources, as well as looking at nanoparticles that we can inject or some sort of biodegradable films or any kind of option that we have to reduce these AAAs and hopefully make sure patients don't need to go to surgery.
Fantastic. Thank you for your time.
Thank you very much for
Congratulations
having
on
me.
some amazing work.
Thank you, and I'm very happy to be here and present our work and hopefully be back next year.